welcome to our Acne Home Care Regimen webinar. I'm Shannon Esau, the Director of Education, and this is Aubrey Carter. They probably know both of us by now, but Aubrey Carter, an educational consultant here at Rhonda Allison, and we are just ready to present. So when we first think about acne, we do need to go through a few things to just kind of get us in the groove of what we're dealing with, kind of some things to think about. So when you're treating acne skin, and we've kind of looked at this as more of a three-step approach to a degree,
Yes.
and how to really begin to take acne and the lesions that are associated with acne, obviously, and really take them to another place when we deal with the wound healing aspect of the lesion too. So, of course, we're promoting or we're helping to reduce bacteria and inflammation.
Absolutely.
So we've got to do that. Cellular wound healing, that's the key thing that sometimes is missing many times in an acne regimen or some of the acne things that are out there, in the industry and things, is really focusing on that cellular wound and how that impacts the overall healing.
Exactly, and also reduces that risk of scarring too. You
Yes.
know, by focusing in on that wound healing, we help to assist that the skin's healing
Right.
effectively and in a healthy way.
Yeah, because it is a wound, and sometimes we don't think of acne that way so much, but it really is a wound to that cell, and we've got to work on it from that healing standpoint. So that's another key aspect that we'll talk about through here. And then, of course, increasing the exfoliation. And that's important for a few things. I don't know how much we want to get into, but, when we think of just the sebum getting kind of trapped underneath the cell and the skin there, that's when the bacteria starts to breed. And a lot of that is because it can't really, get out.
Exactly.
It's trapped.
We've got that buildup of keratin on or dead skin cells on the surface, and it creates that anaerobic or environment where we can't get oxygen into the skin.
And so when we exfoliate, that begins to help that. But we don't want to over-exfoliate and overstrip the skin too. So it's a balance. It's a balancing act. But those are the key things to focus on. And then all of this, when we're doing that, actually then helps not only the acne, but also then begins to, oh gosh, I lost my train of thought what I was going to say. All of this, when you're focused on these three things,
It kind of all works synergistically in the sense that, we're seeing then that increase in exfoliation, we're seeing that decrease in bacteria, that decrease in inflammation, and then even the wound healing kind of performs more optimally too.
Yeah, I knew if you talk, I remember what I was going to say, which that's why it's great to have us both up here. I love it. But no, I was going to say all of this then prevents scarring, because you talked about scarring. But, when you think of acne, and many times, and particularly with teens and younger acne, but all skins, one of the key things that you really want to do is be able to prevent scarring.
Absolutely.
Because once that skin is scarred, due to acne, then that's a lifetime concern. And you can do different things, different peel procedures start to soften, and there's things that can help to kind of disperse that buildup underneath the scar tissue, underneath the skin. But it really is then a lifelong.
Well, and let's face it, while, like you said, it's a lifelong scar, really, if you will, and a reminder of what you may have struggled with in the past, and so we really want to hone in and focus on helping them overcome and not have scarring, and and then obviously increase that confidence too.
So we'll talk about some other things that can lead to scarring, when we get into some of the tips at the end, but ultimately, when you focus, and I think that piece of cellular wound healing really comes into play here too. But certainly, the whole thing and how we bring it all together. But your goal is, really to help prevent that scarring and then stop the acne from getting worse, and then certainly get improvements as you go. So,
and we've got some great stuff too.
Yes, we do. So we're going to kind of focus in home care here and regimens. So let's first go through the different kind of categories that we would say these are what we would really pick for acne skin. So when we think of cleansers, we have 4.
We do.
So we've got our citrus gel cleanser,
Yep.
beta green tea, rosemary herbal, and then of course the all-purpose cleansing pads. And we're going to get to each of these individually. But those are really, we really don't go outside of that much, you know, when you're really thinking of acne and kind of honing in on what's going on with that skin, where I feel like the one skin that you can just kind of go everywhere is aging. You know, they can do stuff that's for acne, stuff for rosacea, aging, you know, all kinds. But when you're dealing with some of these skins that we're talking about here, and particularly acne, really staying in this kind of realm of these cleansers is going to be your best success with that. And then the toners. Cucumber spritz isn't really a toner, but we kind of always put it there.
Yeah, could be that hydrator that they use. So.
That hydrator can be that second option, but it's great for acne. We'll get into some of the uses there. Of course, the beta green tea lotion, berry wine, and then the fruit acid botanical.
Yes.
So all of those are the toners in this acne kind of section here. And then when we get into the rejuvenators, now this goes into the PM typically. There's a couple rejuvenators in here that we kind of can use in the AM, and that would be the first two, the Mandelic Arginine Serum and the Blemish Serum. You know, you can spot treat with those or use Mandelic all over in the AM or PM. But really, when we talk about rejuvenators, remember we're talking about, this is where we get into so many elements, but increasing exfoliation.
Exactly.
So helping to loosen up that glue-like substance around the skin cells. A lot of these are working in that area. Certainly bacteria, inflammation, things like that. But more rejuvenation within the skin sometimes can create, you know, dryness, peely, little flaky, things like that. So you want to watch that. But those are PM, and so we've got a good list of those. You want to go through them?
Yeah,
we've got the Mandelic and Blemish we talked about.
Yep, and then we've got our Blemish Complex, of course our Synergy A, which we'll talk about how beneficial that can be, Salicylic Serum, Skin Smoothing Gel, as well as Skin Refine Gel too.
Yeah, so quite a variety. And many times on this category too, you could have someone on more than one. And when we get to the actual regimens, we'll get into kind of that a little bit more. But so here you can. Now when we go into, you know, the AM, of course, we're cleansing every day and every night. But building and strengthening, this category is so important for acne skin.
Yes.
It really is. I mean, it's a big key. Don't leave this out.
Well, and some of that also can have an impact on like that wound healing aspect too, and strengthening the skin. And you know, there's so many ingredients as we go through each product individually that we'll talk about, you know, how it kind of helps with this aspect and helps with that. But yeah, there's a lot of great things here that can just help to really strengthen that skin.
Yeah. And, you know, therapy, of course, hyaluronic serum, so good, Hydra Complex and grapeseed hydrating serum, and then growth factor gel. We just put the growth factor gel in here, but we've seen acne skins do fine with the serum, the growth factor serum, but using a growth factor with that, you know, new skin cells and kind of strengthening those and just really being a part of the wound healing process. Getting in there. And so those are mostly used in the AM. Some can be, even here, can be used as a moisturizer, so AM or PM, and kind of that step. That's a tricky thing sometimes with acne, is how do you hydrate that skin to a point that they don't dehydrate themselves because they're using a lot of times a little more aggressive on getting rid of that bacteria. So how do they do that and not overstrip the skin? And that's a balance. And so some of these building and strengthenings can be just that instead of going into a regular
two ways.
Yeah. And then of course we do have a few hydrators, or a couple. The Moisture Olay and the Aloe Matte. And then, you know, even the SPF can sometimes be a moisturizer for acne skin, because we've certainly got the E-Zinc. Daytime Defense is a little different, you know, but still for someone that's oily, if they use Daytime Defense, that kind of cuts it, and that might be all they need for the day, and that protection.
It could be perfect.
You know, and then our matte, Color, or our powder, either one, but Color will be good, and that can be a finisher with some SPF, but also then, you know, in some ways giving you some hydration that you might need for the skin. The matte has the hyaluronic acid in it, so that can be a good dual. And then we do have some mask. You know, mask and enzymes aren't always something that we recommend as far as a critical piece to the regimen, but some skins they can be, and I would say acne falls into that category quite
Yes.
heavily, really. I mean, most of your acne skins, if you can get them on one of these, it can really push them.
Well, and that's the thing, we do see how that mask just takes it to the next level.
Yeah.
And, you know, and so it is something that if you are seeing a lot of acne, you want to take that into consideration. And, you know, even if you only have the little half-ounce sizes to start with, it's a really good option to take that skin, like you said, to the next level.
And depending on how they're using it, whether they're using it full face or you can section with these masks too. So depending on that, a little half ounce will give them 4 to 6 to 7 uses and maybe even more. So if you think about them doing that weekly, that's a good time frame for when they come back into you to really be able to know how things are progressing and how it's working. And we'll get into the specifics of those and why you would choose one for this type of acne and another. But that's, you know, our Derma Peel is a little bit different, so that's giving you that enzymatic activity and great for an acne client at home. And then we've got the Milk Mask, the Wasabi Mask, and the Perfection Clay, all options to use. So that's the product choices, okay? And then what we'll do is get into each one.
Absolutely.
So now we'll go through them in a little more depth for you and how you use them for acne and why. And we'll start with our cleansers, which is the citrus gel.
Yeah, and the citrus gel cleanser, you know, this is a non-active cleanser, so wonderful to use if you are performing peels on your acne clients. Great as their post-care cleanser. But, you know, sometimes when you're working with an acne skin, we like to be able to kind of balance it off with a non-active cleanser if maybe the active cleanser is a little bit too drying or stripping.
And let's explain, what do you mean when you say non-active?
Yes.
What does that really say to you? It
means-
doesn't mean this cleanser doesn't work,
Oh,
right?
no, because it's a wonderful cleanser. I love this one. But what we mean by non-active is that there's no added acids in the cleanser. So, you know, when we're talking about post-care in particular, we obviously, the skin is exfoliating, it's in that post-healing, post-peeling state, and so we don't want to add any acids or correctives that could irritate the skin. But the same thing goes, you know, depending on what other active cleanser you have your clients on, you know, you may want to balance it off with a non-active like the citrus gel.
Yeah, sometimes those acids can be, you know, just a little aggressive depending on the skin, and depending on percentage and things like that, it's going to change. And the acids affect the skin in a certain way, and depending on what you're using of the acids, whether that's an alpha hydroxy, a salicylic, or you know, we have some with the lightning acids too, which aren't really in this category, but you know, sometimes could be. But anyway, my point is that sometimes those can be a little bit too much every single day. And so when you, and then here's another thing that I think is important when you're thinking about acne. It's another skin that many times using 2 cleansers is the key. So in the beginning, you're probably going to do 1 cleanser and get them kind of going and really see what's working for them. That's another key thing to acne, is you want to see, if you put them on too much, even of recommended great products, all of a sudden the skin just starts to go a little crazy and you can't see. And sometimes when you start on something like a more corrective regimen here with Rhonda, Allison, or even corrective facials and then the peels, the skin can go through a purging with acne. And that's actually a really good thing. And so you've got to be able to determine the difference between purging and something that's causing breakouts. Purging is something that can happen between the first 3 weeks of using and usually tapers out about that 3rd week or so. So if you give a regimen, and I think this goes across the board, usually if you give a regimen 4 to 6 weeks, that's when you really know if something's working. Does it make a difference? Are you seeing, you know, what are you seeing or what are you not? And then for acne, you know, getting into that 3rd week and 4th week, if then we're still seeing more breakouts, a lot of active breakouts coming forth, then we might think something with this isn't completely doing what we want it to do for this skin, and you can make the changes. And so you got to be able to kind of you know, distinguish that, but starting them on too much makes it really hard to kind of figure out, well, what do I pull off of, or what's working or what's not? So you want to simplify. So 1 cleanser and then adding. You know, in 4 to 6 weeks can be really ideal.
Well, and not to change subjects here, but petite sizes, you know? I mean, we can't stress enough on the importance of a petite size product to really help you out with, like you just said, 4 to 6 weeks. Well, that's approximately how long your petite sizes are going to last, is for about 4 weeks. So, you know, that gives you that insight right there. Okay, no, we're starting to see that change. That purging is ended, and now you can, you know, get them into the full-size retail products too.
Yeah, very important. And then sometimes you might keep those petites for if you go, remember with acne, you're supposedly or hoping, right? We think we're going to continue to see that skin improve.
Correct.
As it does, you're going to need to make adjustments throughout. So we talk about adjustments on any skin, you know, seasonally, you know, things like that. Probably seasonally is one of the big ones, and just what's going on with them. If something's, you know, a change maybe within their body or something, you have to make changes that way. But with acne, you're always kind of in that mode until you get to a really good place, meaning they're pretty much cleared. Everybody's going to have a breakout from time to time, okay? So even if they're clear, they're still going to get, you know, here. And so then you have this regimen now that is kind of keeping them in a really good place, but it's much more simplified, not as aggressive as when you first started with some of the other things that might have been going on. So that's something too to always keep in mind, and where those smaller sizes can help. And then I would say with sometimes the cleansers is, you know, you can do a 1 ounce and then a 4 ounce of one that they use more often. So just always, you know, just keep that in mind, I think, is the main thing we want to say, and use them, because that's really what they're meant for. Our petite sizes aren't samples. They're really meant to be used in so many ways, and for this skin condition, I think are pretty vital and essential to use those sizes.
Yes, I would agree.
So I would say a few other things regarding the citrus gel that's good when we think about the skin kind of acne. I think it goes really well with that dry acne, of course. You know, someone that's really dry or in a climate like we are, sometimes a gentler cleanser, so to speak, which still has some benefits. It's going to get the skin really clean. It's going to remove all that makeup and oil and all of those things off the skin. And then the addition of the zeolite is really a good support for bacteria and toxins in the skin. Is that drier skin can just do so well with a non-active cleanser, and then you go into something a little bit more, you know, on their other regimen where they can more spot treat on the rest of the regimen or something like that. So that'd be probably the main, I guess, skin I would put it in. And then if you're just not sure, or if they're real young, you know, I've read, just some statistics recently, and I mean, acne's starting younger and younger now.
Oh, it's so sad.
Used to it really was in that teen, now it's really in that preteen, and there's so many reasons associated for that, and we're not going to get into that now. We'll be doing some acne education as we go through the end of this year and next year, but you know, you have those, and that skin might need something like the citrus gel cleanser, and then maybe something to spot treat, you know, versus going to something like that rosemary herbal, and, you know, they're 11 years old. And so that would be another place, you know, to kind of put it in getting started on some teens, and not serious like grade 3 acne, you know, you're in the beginning stages and things.
Well, and you bring up a good point too, because we see it posted on the Facebook forum as well, where, you know, you all are asking questions, like you've got a client who's a mom and she's concerned about her children, you know, who are maybe 11, 12, 13 years old, and, you know, they're starting to get a little bit oily, maybe they get a little blackhead here or there, and they're concerned, and so that's where, you know, the citrus gel can be a great introduction.
And I feel like you can really start that around the age between probably 10 and 11. Even, you know, I have a son that's 11 right now, and he's so into sports and, you know, doing all of these things, and sometimes he gets little bumps here or there. And so I've been having him just wash just a few times a week with the citrus gel cleanser. You don't want to start too early or have them overstrip that beautiful young skin and those natural oils. Just your regular, you know, showers and staying clean and things like that will really usually be all they need at those ages and what's happening internally. But as that starts to, you know, more sweat and things like that start to happen, they start to go into those preteen ages, that could be good. And so, you know, I think you can really start it around that 10, 11-year-old age, and then, you know, moving on up. So this would be the choice there, the citrus gel cleanser. So let's move to the next one. That's enough. How much time can we talk about a cleanser? Well, we seem to keep going sometimes. I think we'll just whip through the O's and get to the meat and heart, and we just don't. But cleansers can impact the skin so much, and that's what's so important, and you have to do it 2 times a day.
Yes, and teaching your, one other thing I'm going to mention on cleansing here. Teaching your clients how to cleanse, especially when you're dealing with that acne skin. We saw it with our 90-day live model. You know, she was not properly cleansing her skin. We taught her the proper technique to use 4x4s, and just from cleansing her skin, she already started noticing a change. And then, of course, it was a 90-day program, so she saw some really good changes. But, you know, you'd be surprised. They just sit there, they lather it up real quick for 30 seconds and splash that water on their face, and they think, oh, okay, I'm done.
Yeah, it's so true. And, you know, you pretty much said everything I was just going to say. I'm like, she's saying everything I'm saying, too. But we had a young teen that used the Beta Green Tea Cleanser, which we're going to talk about next, and said, you know, that's just not working. And we went through that cleansing thing, and because I was kind of in a state there and looking at her skin and where it was at, and I thought, surely she should be getting some progress here. And that's how confident we are with this cleanser too, and just sometimes that making the difference depending on what else going on and how severe the acne is. And so I asked her, and she was splashing, you know, so not really getting that skin clean. And so sent her home with some 4x4s, night and day, and just literally night and day. Within 2 weeks, I mean, it was just, you know, such a huge difference. So that's important. So let's talk about this Beta Green Tea Universal Amazing Cleanser, but focus it in on acne today.
Yes. You know, it's a great cleanser because of that ingredient deck. We've got the salicylic acid and the heart of the green tea plant in this product. And those 2 ingredients, they provide so many anti-inflammatory properties for the skin, which, remember, you know, as you said, we're dealing with a wound, we're dealing with a lot of inflammation on the skin, and just from cleansing with ingredients that are designed to help soothe and reduce inflammation, let alone provide antibacterial properties as well, can just really work very well together. And then the salicylic acid, you know, of course, that's also going to help with, I don't really want to say like promoting exfoliation because it's in a cleanser, but you know, it can help to start breaking down some of those lipids that may be holding those dead skin cells together.
And start that process. And the salicylic will give that bacteria support too. So with this cleanser, you're being able to target inflammation, redness in the skin, as well as bacteria, and then get you a really, really good cleanse. We've just seen it calm the skin so nicely.
It's amazing.
So, I mean, this would be, I would say, that starter cleanser for almost any of them. We can get more specific, which we will when we talk about the rosemary herbal, and then, of course, we kind of gave you an idea for that citrus gel. But most of your acne will be really awesome to start them on the Beta Green Tea Cleanser, and then add from there if you needed to go a little stronger, maybe put that rosemary in a 1 ounce size. Or if they wanted something like the citrus gel that wasn't quite as active, sometimes maybe they're a little more sensitive to the salicylic and things. In general, it doesn't dry out the skin, but you know, sometimes you'll have that, then do that citrus gel, or just to get some of the benefits of that. So kind of any beginning acne, I mean, we would go here and you're gonna get great results. So that's the Beta Green Tea Cleanser, and then let's move into the rosemary herbal.
And you know, the rosemary herbal, this is that one that we've got that glycolic acid. So, you know, glycolic acid is actually a great ingredient for that really oily, thicker acne, like even pustular acne. It responds really, really well to that glycolic. So this could be that cleanser that, like you said before, maybe you start them off on Beta Green Tea, and then because, you know, they just need to incorporate that rosemary herbal, you know, maybe 1 to 2 times a week to just reduce those surface lipids, or they're just extremely oily, and this is maybe the cleanser that they use 1 time a day, and then maybe citrus gel the other.
Right, they could do that too. And I would say where else I'd put this, if someone is kind of that oily grade 3, then I would go here. Now, however, when they get up into more of a grade 3 acne, they do have a lot more, they hurt a lot more. So Beta Green Tea is very soothing. Okay, so you could, it depends on where you're at with things, and we could maybe hit this with some other regimen steps. So like if you started them on the rosemary and herbal, and then you went into the therapy E, you know, really healing and kind of calming, or even the Hydra Complex maybe, or just something to kind of soothe that skin a little bit more. So that's the only variable there where I could see this sometimes maybe being too aggressive for even sometimes a grade 3, just from that aspect of their skin kind of hurting. But most of the time that's what we'd start them on. I mean, and that's going to get you, the bacteria is the key at that stage. You know, the redness and things like that we'll be able to work with, like I said, throughout the regimen. The other skin that I find this to be really helpful for, because you did talk about that AHA component, but what this AHA really does is what's so phenomenal about alpha hydroxys is they help to loosen up kind of what's holding those skin cells together. So when you begin to do that, if you understand with acne, we talked about the exfoliating piece, this can really support and really start to move and drive. It kind of gives a little bit more purging sometimes in the beginning, because it's allowing for all of those kind of oils and things that are trapped and kind of new cells to start coming forth. But really, really important in the beginning stages of dealing with acne. So when you see, their skin almost looks tight.
Yeah.
You know, how do you describe that skin? I don't know, other than I've seen it a lot of times. We might need to try to find some pictures for you too, but it just looks tight. The skin cells, it just look like tight. That's the way I can describe it.
Yeah.
And that skin needs sometimes something like this.
Yeah, it needs that exfoliation.
Yeah, it needs something to just help to kind of let those skin cells go. Do you have any other way to describe it? I mean, I've seen it so many times.
No, well, I mean, maybe we...
And
we'll
even a
have to
little
try to
with
find a picture.
Kamalani's skin, who she's one that we've worked on in here, you know, and hers is continuing to soften, and you can tell some differences and changes with her skin over time. But I would say hers were a lot more tighter pores, tighter kind of those cells just holding on. It's like you can see it. So you probably know more of what I'm talking about as you're like looking at skin, working on skins. You can almost really see that to the visible, and when you're looking and feeling that skin, that kind of skin needs sometimes more of an AHA. Or mandelic, which we'll get into, that could be a support too. So if they were a beta green tea cleanser user, then maybe mandelic could be that option. And we'll talk about skin smoothing and all that as we go, and how to really incorporate it. But that's where you could use this too. So I think this cleanser really falls into oily, grade 3, and then, you know, that really tight compacted skin, and then just a lot of bacteria on the skin, and then you can rotate around.
Yeah.
Pretty much gets it. Okay. All right. And then let's move into our all-purpose cleansing pads.
Exactly. Yeah.
These are great.
These are great. You know, in the all-purpose cleansing pads, they too have that heart of green tea coupled with the salicylic, so a lot of anti-inflammatory property ingredients there. But then, you know, the fact that they're in a pad that's in a liquid, they are going to be more aggressive when you're using them, more corrective. We've also added in the totara extract in there too, which is going to provide some wonderful antibacterial properties to the skin. And, you know, and that can also help to support when we're dealing with a lot of breakouts and just a lot of bacteria.
Yeah.
And there's so many different ways of recommending this product.
Yeah.
So, you know, you had talked about like teens that are into sports or that are sweating a lot. These are great for them to have in their, you know, in their workout bag, their gym bag. So that way when they get off of the field or, you know, out of practice, they can swipe it right over the face, eliminate that bacteria as they're on their way home, and even swipe it in their, you know, helmets, chin straps, because, you know, let's face it, they're probably not doing that right now, and that's just a breeding ground.
Exactly.
You know? So that can be very beneficial that way too.
Well, and then if they are a little bit drier, or if that seems to be drying them out, then have them do that, and then just tell them to wet the pad after they do it and go back over the skin, and then they can put either something over top if they wanted, like, you know, Hydra Complex, or there's so many different things that you could do. Spray with cucumber spritz for a little hydration. But sometimes, because it is sort of like you said, a little bit in that toner form, and using it all the time can be a little much for the skin for some. So what you would do is still have them go through the process, just wet it, and then, you know, do it one more time. The other thing too is just remember that we don't want this to replace the regular cleansing. So it's for those special things, like you said, after some sporting activity. The night when they're real lazy, but almost don't say that, because you got to get them out of that laziness.
Exactly. They
Like,
need
let
to
it be
take
that.
care of their skin.
But you know, there's times when you want to say, okay, if you really can't wash your face, at least do this before you go to bed. You know, and get some of that dirt and all of that stuff off the skin. So they can be used in so many different ways too. And just love these, and the ingredient deck's so great and very healing. But just remember that it's you know, can be a little bit drying if you're using it too often. All right, so that's our pads, and great to go for anyone on the go. Then we'll go into the toner section. Now, acne, we do recommend toners more often than probably sometimes other skins, because it really is an extension or a part of that regimen results, and to kind of further that skin along. Because most acne, and not here, so it's like where we are in Colorado, we have a hard time finding an oily acne skin.
Me too.
So we've learned a lot about dry acne, and we can totally handle that. But when we were in Texas, and we have, you know, people all around, and as we see, but you know, when we were in Texas, it was easy to find an oily acne skin because of all the humidity and things like that too. So, but my kind of getting off track is that toners, especially if they're oily, can really support that skin and just make such a difference, and keep that skin kind of, you know, from not producing too much oil during the day, and add so much support, which we'll get into each one. But the cucumber spritz sort of falls in a different place. I thought about moving it from toners, and then, you know, it just kind of goes back and forth, because it can be sort of that second little spritz. But honestly, I wouldn't think of it this way for acne, so I probably should have moved it. But I would say cucumber spritz can even be that hydration support that is so hard for many acnes to find that right balance.
Well, and you know, and the thing to remember too, when we're talking about acne clients, they're afraid, you know, they're afraid of creams, they're afraid of a serum, they're afraid of pretty
oily,
much everything.
Like we have our grapeseed hydrating serum,
and
they're like, oil, what? Yeah.
But because, you know, they feel that if anything feels too heavy, it's going to cause breakouts. And so this can be a really easy sell, because they can just spritz their skin. It has the sodium hyaluronate in there. It has the heavy water, so it helps to hydrate those epidermal layers of the skin. And it does so without making them feel like heavy and oily and, you know, oh my gosh, this is going to be a comedogenic product, even if it's not.
Yeah, because sometimes with the overstripping, we deal a lot more, you know, with the lipid aspect with acne and kind of what's happening in the trapping of the oil and all of that we're talking about. But the transepidermal side, you know, the more of the water content within the cell is being stripped so much with everything we're using. And so cucumber spritz can be really great, you know, for that. And just, like you said, just being something simple and being all they need. They just spray and then kind of a little depotement, let that sit on the skin, and that can feel good and keep them enough hydrated, depending on, you know, one to the other, and then they're good to go. And especially at night, you know, before bed, what do they use? And then you could put anything over this. You know, you can use it in conjunction with like the hyaluronic serum, which we would certainly recommend many times. The growth factor gel put on top at night. There's a lot of things there where you can use this, but then sometimes when they feel a little bit more oily in a sense, but yet they have, you know, some of that need for a moisturizer, use cucumber spritz. You'll be surprised. And then of course you can use it through post-peeling with them to feel good and add some coolness. And then those girl or women that you're dealing with acne, to help with mineral makeup if they wanted to set that, if they were using the powder or even the matte. So different uses there, but I would say more as a moisturizer step for acne than anything else. Okay, so now more of a real toner. for this category. So Beta Green Tea Lotion.
Yeah.
Really, really great.
Again, you know, beta green tea. So we know that when we're talking about that beta green tea line, that it has the heart of the green tea plant. So really high anti-inflammatory properties coupled with that salicylic acid component. You know, and again, what this is going to do is, because it's in a liquid versus the cleanser, it is going to be more corrective. It's going to be a little bit more drying on the skin, or balancing if they're really oily, you know. It can be very beneficial in that regard. So, you know, while most acne skins, you could probably recommend this to. Dry acne, probably not, you know. And then what's beautiful about this product is, you know, we always recommend starting off 3 times a week. You know, just kind of easing them into it. Of course, if they were really oily, you probably could have them use it on a daily.
Grade 3 too, going into oily, you probably use it more often, but yeah.
But you know, start them off, easing them into it, check in with them, see how it's making them feel. Is it drying them out? Do they not feel that it's drying enough? And then you can adjust. But the other thing is too, is that as they transition and maybe now their sebum activity is more balanced, but they still get those breakouts, they can spot treat.
Yeah, and you can spot treat either way. Like you said, you can do it, if you did the toner 3 times a week, spot treat it on the other. So that would be where you're trying to initially give them a simplified regimen, not go too much so you know what's working. You can use this for multi-purpose. And then you bring in another heavy hitter that could be a more spot treater as you, the next time you see them, or as you kind of, you know, have had them on this for a little while and then you need further results. But yeah, so great way to use that in both of those situations. And I would say, you know, you could certainly use this PM too, but more AM. It does have that antioxidant support too, which is many times missing, you know, from acne, because your traditional antioxidants and those, and they still need protection from the environment, and so that they don't create more damage within their skin, you know, just due to the fact that now they have acne and, you know, they don't have the ability to put this or that, and some stay away from sunscreens, you know, too. So then they're really exposed out there, you know. And so this can be good from that kind of thought process too, is remember that it is a very high antioxidant support, and it stays on the skin. Okay. So yeah, that's pretty good on that one. Then we have, oh, I didn't mention this. I brought this over, and I meant to put this on the other, but the berry wine, because even though the berry wine is firming and all of those things, we've seen it really work on some acne when you need a lot of that AHA component. And so, you know, it might be something, and that would be sometimes those, you know, a little bit of an oily skin and really kind of compacted and tighter pores, and those skins that you need to, or even sometimes cystic, and get some help with a toner. It just depends. Maybe even, you know, gosh, 25 and overs could be really good with this particular one. And so I didn't want to leave it out, because, you know, when we talk about the fruit acid, that's a little, we're talking aggressive, okay, but works, but it's very specialized for, you know, the grade 3 and things like that. So this one comes in, and it has all of the alpha hydroxy acids with the lactic, and it also has the malic and tartaric, and just really is good on the excess oil and it has sebum.
And it's got salicylic in there too, you know. So I mean, like you said, like when you're dealing with that adult acne, and maybe it's not, you know, where they're dealing with like a ton of inflammation and things along those lines, this is actually a really good option for them, because they get a lot of antioxidants.
Yeah, a lot of antioxidants.
In a form that isn't going to be irritating, and and then they've got all those AHAs, like you said, to help support that cellular turnover and that gently loosening of that, you know, glue-like substance that's keeping everything compacted.
So just really great. And you know, when this was first you know, formulated, it was kind of mainly thought for acne, and then it's taken on a few faces over the years, and then just really recognizing how many other skins do so well. So I would say it was kind of acne aging and a lot of that. But so don't, you know, kind of forget about the berry wine and that higher AHA component without being quite as aggressive as this fruit acid botanical, which we'll talk about next. So that one, you know, kind of goes to another level, right?
Yes.
But it works.
It does. It works amazing. But here you're talking about glycolic and salicylic acids.
Yeah.
Those are two very potent acids. The way that they're in this formulation, it is designed to really reduce those surface lipids and to increase that loosening of that glue-like substance, holding those skin cells together and promoting that, lifting and cellular turnover. So it works,
And spot treat with this. Use it. Sometimes we'll have people just kind of, you could even spray, spray cucumber spritz on a 2x2 gauze, and then the fruit acid botanical on top.
Nice, to just gently kind of
just
dilute
cut it a little bit. Spot treat, you're going to have some, and I would say where it falls more that can use it all over, and more often is going to be sometimes men with thicker skin, a little more oily, not a dry or real sensitive, but kind of that thicker skin. And then many times those grade 3 acnes, this is what they need for about 3 to 4 weeks to really get that acne kind of almost give it a punch like I just did. I didn't mean to do that, but just really knock it out of there and get a lot of that bacteria out, and really help with the exfoliation and almost dry the skin out, and then start bringing in more balance. And so uses, and then of course, and I think we both said maybe spot treating. Okay, so certainly you can do that. Now, the one thing about spot treating with this particular formulation, and a couple others that we'll go into, but when you do spot treat with fruit acid, make sure that you don't do that 2 times in a day, and even sometimes the next day. So what we'll do is tell them, whenever you spot treat with it, if you get a new breakout or something like that, go ahead and dab it on there, leave it on, and then don't do that same lesion for at least 2 days. Because what's going to happen is it'll start to scab. And it'll be too much, and that creates another wound, and then that creates longer healing where you have that leftover kind of element, redness and wound within the cell, happening. So you want to do that is have them wait 2 days. So this is strong enough that it can also create a little frosting sometimes when they do it.
So when they spot treat, we don't want to just sit there and hold it on in the area.
Dab it on and you're good.
Just dab it on.
Yes,
exactly.
And then they might need to do a little fanning because it's hot. I know I do. If I use this, I don't use this, but and redness is fine. You may be using this in the treatment room. The fruit acid is an amazing one in the treatment room, though, especially prepping before peels and all that with your acne. But it gets the skin really, red and hot, and that's a normal response.
Yes.
Okay. All right, so then what are we moving into our rejuvenator section? All right.
So kicking it off with the blemish serum.
Yeah, kicking it off.
So, the blemish serum, this product, as far as formulation goes, we've got salicylic, we have the mushroom extract, and we've got that totara that we mentioned before with the all-purpose cleansing pads. And, totara is almost like nature's form of benzoyl peroxide. So, it's going to really help to support the skin in a lot of different ways as far as antibacterial properties, reducing inflammation in the skin, and can just really be very beneficial and a key component when you're dealing, especially with grades 1 and grades 2.
Oh, yeah.
Grade 1 and grade 2 of acne.
Yeah.
But this product is, as you've mentioned so many times, it was designed to be used on a daily basis.
Yeah.
Without over drying and causing, flaking and irritation to the skin.
Yeah, so a lot of times the teen, particularly if you can get them to wash their skin at night and put the blemish serum on all over, and then in the morning, if they just wash their skin, and I'm thinking beta green tea cleanser here too, but there's variables, and then put the beta green tea lotion on and went about their day. That's and that's really just those 2 steps. Now we want to maybe add in the wound healing component, which could then be like the growth factor gel or hydra complex serum, something along those lines to then kind of further support the skin. But the mushroom extract and the totara really have good healing components to them too. So they're not only dealing with the bacteria side, but they're also doing it in a gentle way where they bring healing to the cells. And that's what's key with this and kind of the whole formulation of the green tea, blemish serum, and the beta green tea and things like that. But so that's really an ideal way to use it, I would say, for teens. And then anybody else, we always have blemish serum with us.
Yes.
Everybody has blemish serum because like I said, anytime you get a little breakout, dab it on and it will knock it out.
Yeah.
But just spot treating with it, using it in a regimen. If something's too aggressive for, when you get into, those higher grades of acne, then have this as a spot treater that they can use more often, and then they use something more aggressive a few times a week. So you can do things like that too. Beautiful formulation, a great starter in a sense. But I hate to say that word because it's not really a starter, like meaning we have to go more. It could be all you need.
Well, and I just want to kind of piggyback on the fact that you had that very simple regimen that you mentioned, and and the importance of that simple regimen, and simplicity really is the key here. I mean, and we stress that enough, but certainly.
Yeah. So then, kind of a little different gear here is we'll go into. Because I feel like this works a little bit partnering with the blemish. So when we talk about mandelic arginine, which we talk about in everything, so we have to talk about it here. But
the formulation.
Oh my gosh, yeah, and for acne, ideal.
It is. The mandelic acid, mandelic works like an alpha hydroxy in the sense that it's going to help to promote that lifting and that cellular turnover. So it's going to gently loosen up that glue-like substance that's holding those compacted cells together.
Right.
It's antibacterial. We've got the arginine in there, which promotes wound healing.
Yeah.
We've got tyrosinase inhibiting ingredients in there too, which can help to reduce that risk of PIH.
Yeah.
I mean, it is an amazing formulation for acne-prone skin. And so many of you talk about how you've seen it take your acne clients to that next level by doing something that's actually not causing irritation either.
Well, and I know like our acne management system, we had a young, probably 15-year-old little boy, had him using the beta green tea cleanser, mandelic arginine serum, and growth factor gel. Those three things, those three simple steps. And his acne was in, what would you call it? I guess almost grade 2. Kinda.
Yeah.
I would say red, because he had redness and a little bit of inflammation, going on, and pustules certainly kind of all over. Really, it wasn't just isolated to maybe more hormonal or things like that. So he had a lot going on there. So probably grade 2 is where we categorize him, and that's all he did. And those 3 steps. Over really the first 3 weeks got better, 6 weeks even better, and then almost between that 2 and 3 month time period, his skin was perfectly clear.
Oh, yeah. I mean, his picture's on the back of the box, and I mean, to see that change.
And he, and for that age, oh my gosh, he couldn't have been more happy and ecstatic, right? And that's what happens. But it's so simple in that way. And then, you know what, if he was still having, it's working, but we're still getting a little bit of breakouts, then we add something in, and then we kind of grow. A mask would be good at that stage for that kind of client. Do a mask once a week or, something like that. But that's how mandelic can work, and just those simple components. Now, some might need more bacteria support, and that's where something like the toner, or then we'll talk about a few others, or partnering with the blemish serum.
Yep, absolutely.
So that's still, and the great thing about the blemish serum is the price point too. So you can add that into one of these regimens along and just spot treat for more bacteria support. So mandelic is just great all the way around, and almost you could have it on every single acne client depending on the needs and kind of what you're doing, but a really good piece. Then our next thing is kind of our BPO option. This is the blemish complex.
So yeah, blemish complex, this is one that obviously it's not going to be used for your grade 1, grade 2. Like, this is where we most likely want to bring it in when we're dealing with more of grade 3 acne, that cystic acne, a lot of bacteria on the skin, as benzoyl peroxide is really designed to help with reducing bacteria, but it's also designed to help act as a peeling agent too, and will cause some lifting and exfoliation in and of itself. And then this formulation, we've incorporated some anti-inflammatory ingredients too, because that's what, we know that we have to reduce that inflammation in the skin.
Yeah. Because when we first had the BPO formulation, it was like, you know how we talked about the fruit acid, just spot treat once and that's it? That's how this was. Because if you did it 2 nights in a row, you had scabbing, you had other things and other concerns going on the skin. So added some other components to this, and the formulation is a lot more skin friendly. And I would say, you know, I have seen this work though on grade 2 acne from a standpoint of even just once a week all over. And you'd be surprised at how that really works and helps. Now, not everyone, see, that's not the cool thing, because don't we wish it was just as simple, but that is the neat thing about all of us, right? We're all individuals, and that's the great thing for you and what you do is you can begin to learn and customize and read and understand the skins and really make those targeted recommendations to get the results you need. And sometimes it can be, maybe you don't know in the beginning, but you're using, you know, the blemish serum and some of these other things, and it's just not clearing. Then you want to go back to the drawing table, and a lot of times a BPO all of a sudden can be the answer.
Exactly.
You know, and then sometimes with acne, I would say particularly when you're dealing with hormonal acne, because when you are dealing with hormonal acne, the hormones aren't changing yet, you know. So no matter what you're doing here, you're still having some acting up internally, if you will. And so changing up, because our skin is very smart. Our skin figures out kind of what's going on after long-term uses, especially for certain things that we're trying to do here. And so with acne, we've seen, you know, just rotating someone from AHAs to salicylic, or then bringing in the mandelic, BPO, and kind of having some options to give that skin a little bit more, keep it confused, and really push it along to get the results you're looking for. So that's some other ways to kind of move into this blemish complex. I would say just when you're kind of stuck sometimes is think about this one too, and then certainly like with the grade 3, and then just spot treating as well.
And, you know, and you bring up a good point when you talk about, you know, if you become overwhelmed, you're like, oh my gosh, there's so many options. There's so many options though, because like you said, everyone is different. And, you know, what may be working on one person may not necessarily work the same on someone else. And so, you know, by having options to go to, you can truly make that difference in somebody's skin.
Yeah, definitely. So you've got blemish serum, mandelic arginine, kind of similar in strengths. Blemish is going to be a little bit stronger with bacteria. Then you've got a BPO option. And then we've got 2 that we're going to talk about, the skin smoothing and the skin refine. I like to just sort of talk about those together, just because to kind of help you. The main way to think about these potentially, or probably, would be saying skin smoothing, an AHA approach, skin refine, a BHA approach. So if you kind of think that way, a lot of times we go for the BHA on the first go round, many times, but you know, if someone comes in and they've been using a lot of salicylics and they're trying to get results, go for skin smoothing gel. And vice versa. If someone's been using a lot of AHAs, put them on skin refine. Now, these are too strong. They're both, you know.
They are potent.
They're potent. That's a good word.
You don't want to just be putting this on like every single night, 7 nights a week, and, you know, could cause a little bit too much irritation there.
Yeah.
But they work, though. And that's the thing, is that, you know, they get that exfoliation specifically that we're looking for. You know, especially when we talk about the skin smoothing. I mean, that's going to just help to support the skin in such a way. And so, you know, I would say we use skin refine and skin smoothing more on those oilier and those higher grade of grade 3, but they can be brought into grade 1 and 2, but just very thoughtfully. So 1 time a week, you know, to add, or mixed into, you know, maybe the Moisture Olay or a moisturizer or something that they're using when you get into that. So other ways to go there, but know that they're both, if you use them too often. Now, sometimes on an acne, you have a little more leeway because their skin's so oily, and so you can get it on a little more. But start out with that every other to every third night. That's going to be your best bet, and really see how that skin is. Because you don't want to bring that skin, even though we're talking about exfoliation, we just want to help the exfoliating process. So within our cells, we have natural exfoliating division of cells and exfoliation happening, right?
And so what we're trying to do is help it along, because sometimes the dead skin can't let go because of all that compaction. And we're trying to help that oil and help bring some oxygen and some breathing, and that does that when we can loosen up those dead skin cells and kind of help them to let go. But we don't want to go too aggressive. Sometimes, of course, with acne, we really feel like peels are in order, because peels can really take an acne skin to where you need it to be. And so this is kind of that home care peel with the Skin Smoothing or Skin Refine on some, but you just have to monitor that and make sure that they're not doing it too often. So that's really all I'd say about that. And then I think just knowing AHA versus BHA, they both work very similarly. Having a bacteria support and helping to kind of loosen or dissolve or kind of open up those skin cells a little bit more, and really make a difference.
Absolutely, yeah, that's
so choosing those, and then we go into another facet, or kind of now what do we do when we're talking about these vitamin A's, and how do they really come into this acne regimen? Well, originally vitamin A was discovered for acne.
Yes.
So that's the one thing. So quick on the scene, I feel like. Not long after, aging was like, oh my gosh, we can use this for aging skin, and that sort of took off in its own world. And so most of the time we think of vitamin A for aging more so, but it really has a huge support to an acne skin, and it does have some bacteria support too, and then a lot of support in helping the skin to really exfoliate in a sense.
exactly.
And kind of do that piece and inflammation support too. And so,
yeah, and and that's the key with the vitamin A is, it is designed to help with increasing that exfoliation, normalizing that cell differentiation, providing some antibacterial properties and so forth, and just different properties to really support the skin and strengthen it from within. And we talk about that wound healing aspect.
Yeah.
That's where really strengthening that dermis can be beneficial for the skin too.
Yeah. So these would be, something that you would add at night, and going to really add another element of support. Now, there is some differences here when we talk about the two that are kind of primarily for acne. This first one, Synergy A, that comes in more from a repair standpoint, a drier acne.
But even though,
maybe
depending, like a drier acne,
inflamed acne,
that can be beneficial there. Or, as someone, maybe they started off oily and now they're kind of balancing out that sebum production, and so then you can switch them from maybe salicylic serum onto Synergy A.
And when they get into more of that healing stage, so you've gotten rid of a lot of bacteria and things like that with some of the other things we've already talked about. And now you want to kind of help more with the healing of the skin, inflammation, redness, repair.
Formula for that.
That is where Synergy A comes in, because it has the addition of stem cells, the vitamin A component, and the whole functioning of this particular formulation is just really going to just give the skin a lot of good support and health and repair, all of that. And so that's where I'd say, to figure out how do we add this in. I wouldn't jump on this for a teen. I'm not going to say, every acne initially just get them on Synergy A. I think when we talk about salicylic serum, that has a better place overall. But I will say that we've seen it, and now this is our dry skin experience coming out, works so amazing on the dry skins and their acne and what they're dealing with, and really be a huge support. And then, kind of the reparative side.
Yeah.
So I think that's where I'd probably coin that or put that, and an amazing formulation too. I mean, just beautiful. Then the salicylic serum, so this is your other vitamin A.
Exactly.
And this one is going to be just more, aggressive from a vitamin A standpoint.
Yeah, well, because, with this one, whereas the Synergy A, we don't have an alpha or beta hydroxy acid in that formula. In the salicylic serum, salicylic acid is obviously going to be coupled with that vitamin A, so it's going to cause a little bit more exfoliation to the skin. which if you put it on a dry acne skin could cause them to become more dry, flaky, and irritated. So that's why it's nice to kind of have that option. But for someone though that's oilier, like you said, I mean, that could be a really good option for them.
Yeah, and I've seen some that are drier but just use the the salicylic serum like once a week, and they feel like that's really keeping their skin in a good place. I think it's a really good one to choose, and I like it along with like blemish serum or Mandelic, so you're not going into, let's say, skin smoothing and skin refine, or even the BPO at this point. You're doing a little more aggressive with your salicylic serum, and then bringing in something that they can use more every day that's not overly aggressive, and that seems to get really good results. On another regular basis, you might have someone, if they were going to have that as one of their main correctives, is use it every other night to every third night, and let's see how the skin's doing. But that once a week can really just push it along and be really great.
Well, and you know, and when you're talking about skin that's in their 20s or even like their early 30s, you know, they may not need the vitamin A from a standpoint of the like supporting the dermis quite the same way, but they need that cellular turnover and, you know, that component together, and that's where using it, you know, one time a week or maybe just a few times a week could be beneficial.
Certainly. Yeah. So, and I don't think we really mentioned on the Synergy the way to use that. You can use that a little more often. So every night, but maybe starting off every other, and just kind of see how the skin's doing. Vitamin A will purge the skin, though. That is one of the ingredients sometimes that can add additional purging, because it accelerates that cellular turnover many times, which is good to kind of drive everything out. So many times Sal Serum in the beginning could be good, or even Synergy A. So just some things there, you know, kind of to think about with the vitamin A's, but pretty key and essential, I think, for acne and most of the regimens, and what we've seen for that real good result when you're dealing with the higher grades, oilier skin too, and in that more reparative phase. Okay, so we're going to go into what section is this? Building and strengthening. Okay, so let's go into the therapy. So we'll start with that one.
And you know,
we're
therapy,
like, who's going to talk?
Who's going to start, right? But you know, Therapy E, this is a formula that it's really designed to provide a lot of healing properties to the skin. Of course, antioxidant properties too, but that healing component, and because we're using a refined form of vitamin E, you know, sometimes you may think, oh gosh, vitamin E, I don't want to put that on acne-prone skin. But this was actually developed to be used on acne, oilier skins, because it's a refined form of vitamin E that's just going to absorb beautifully in. It's going to help to soften up that scar tissue and provide a nice amount of hydration and antioxidant properties too.
Yeah, and certainly post-care when you're going through peeling with them, but it can be that simple. You know, spray with cucumber spritz, put the Therapy E on, and it can be really simple when you're in that healing stage too, or, you know, a lot more inflammation in the skin, things like that. Therapy E would be really a great companion once or twice a day, and it's going to help to prevent from scarring too, and be a good support for the skin. And I mean, we wouldn't probably recommend the Therapy E on grade 3 acne, but to some degree maybe, it just depends. But in general, you know, your sensitive skin, acne, dry acne, things like that, Therapy will be good. And then for post-care, it could be used on any of those skins. So that's the Therapy. Let's move into the hyaluronic serum.
So, you know, hyaluronic acid, we talk about just how wonderful of an ingredient that is, because it's going to help to increase the hydration levels in those epidermal cells. And so as you had mentioned earlier, you know, we're usually using ingredients that are going to help to, you know, reduce down on those surface lipids. So that means those epidermal cells are going to be a little bit more dry, or transepidermal water loss could be, you know, taking place. And that's where the hyaluronic serum is going to help to reduce that risk. And if we can reduce the risk of transepidermal water loss, we can make the skin believe that it actually is in a more balanced, hydrated state. And, you know, and that's going to be beneficial from the sense of, if the skin's not feeling like it's constantly stripped and missing lipids, oh, I need to produce more, you know. So this helps to keep everything in balance. It's lightweight, it absorbs beautifully. And you mentioned coupling it with the cucumber spritz too. and that
Yeah.
can be very beneficial.
Yeah, and you want to, in many cases, and particularly drier, a drier environment or things like that, add that in. But yeah, the hyaluronic with the cucumber spritz is kind of the duo that we usually sell together. They certainly can be used independently, but when you think about that hyaluronic and how it helps to kind of keep the moisture and retain that within the skin cell, sometimes if it doesn't have moisture to draw from, if it doesn't have anything else there, in many cases it can actually dry out the skin more, but it doesn't work to the way that it should. And so adding the cucumber spritz can just kind of help that piece and work on that transepidermal water loss. So it could be, and it's enough to just keep that skin where it needs to be without being too rich with the formulation and causing an acne to break out. And that's your thing. How do you get some hydration on the skin or help that skin when it comes to good natural moisture that it needs, because we're using so many things that are kind of stripping the skin, reducing bacteria and all these things and almost drying the skin out. You need to do that with acne, so don't kind of skip out on this step. And these are more of those in that category of building and strengthening, because they add so much more to the skin and overall support. So really, really great to use the hyaluronic serum. And then the Hydra Complex serum is next. This is great too.
Yeah, refined grapeseed oil in here with the wild yam extract. I mean, this was specifically developed for that hormonally challenged, hormonal acne skin. We see great results though on actually a lot of different acne skins when we're talking about this formulation. And just keep in mind that grapeseed, again, it's refined and it's non-comedogenic. And so it's not going to clog pores, but this is one where you got to kind of ease them in, like gain their confidence. No, this is going to be beneficial. I know it feels like an oily serum, but trust me,
it goes right in. I know you really do, and you have to kind of do that. But I like to talk about this too a little bit with the grapeseed. There's certainly different formulations and certainly different price points too. However, they are both that grapeseed component. So the way to sort of kind of think of them is just what Aubrey was saying, where this one has that more hormonal component and support to the skin. So with that wild yam extract as opposed to just the grapeseed, and the grapeseed here is refined a little bit more, which makes it a lighter oil. And so that's really the difference. And we have, we mentioned Kamalani here too, and she prefers the grapeseed oil,
exactly.
the grapeseed hydrating serum, over the Hydra Complex, but that's because she's a little more dry, and we're in the climate of Colorado, versus maybe another in a different area might like the Hydra Complex more. So you can let them feel it. Neither one will break out the skin. Both will hydrate and help the skin and balance and give it antioxidants and other healing support. And then the Hydra Complex is going to help with that hormonal side from the skincare standpoint, or from the skin standpoint of the imbalances from hormones, okay? So that's really the difference between those two, and you can kind of pick either one and add as a great option. And then we have our growth factor gel.
Of course. So, we talked about that wound healing component being so crucial. And while, the building and strengthening category, each product has its own benefit to the skin, your growth factors are really going to be that key component to promote healthy wound healing, healthy tissue regeneration. And that's important to reduce that risk of scarring and, and to just help ensure that that third step, if you will, in an acne regimen.
Yeah, and so it can be that like all of these that we've talked about are that moisturizing step, really, even though they're in the building and strengthening. And so they can be that a little bit different and unique, hydrating, healing support for them. So we went into, the cleansers and the toners and the rejuvenators being more of that corrective and really kind of targeting that bacteria and really helping the skin in all those ways, and exfoliation. And these are more healing, building, strengthening, and like Aubrey said too, helping you to prevent scarring. So that's going to be such a key thing, that cell is depleted of. Those cells as this nutritional aspect. And so these are the formulations that can work. And growth factors, we said for a long, long time, is that we probably wouldn't have an acne not on a growth factor. Now there are times, and we do that, and recommend it without. But if we can, and we're really thinking about it and trying to, target, we want to add that growth factor because we've seen it really heal those lesions and add such a support, and then be kind of like a moisturizer too. So really, really good. Now we do have the 2 moisturizer kind of creamy that we can talk about here. And as we go into those, the Moisture Olay is one, and that can be, used outside of these others. What I like about the Moisture Olay for acne skin a lot is adding in a corrective to it because it's such a great base of so simplistic and just that milk protein, which milk can be very healing for some acne skins, is that you can add that. And that it softens the corrective a little bit, bumps up the moisturizer, and really, really works.
Well, and you had kind of mentioned mixing the skin smoothing gel or even like skin refine gel. This is a great product to mix with that, so that way maybe you can get it on the skin a little bit more frequently.
Yeah.
But you're going to do so in a way that's not going to create that
over exfoliation. And even the salicylic serum, create a vitamin A cream and do that at night. They could do that, a few times a week, more so than the other, and they just put a pump of the salicylic serum into the Moisture Olay, and that'll keep their skin in a really great place at night without just being too advanced or too not advanced, aggressive, corrective, too much or too aggressive for the skin. So that's where Moisture Olay comes in, and it is healing, but younger skins probably just by itself, but using it as a mixer can be really a great piece to the formulation, and it has the vitamin E and other healing components too. And then the Aloe Mat. So that's kind of the main one, I would say, in this cream category.
Yeah, and for those of you out there, I think that a lot of you do use Aloe Mat, because I certainly see it posted a lot on the Facebook forum as a recommendation. But that Aloe Mat though it's got the sodium hyaluronate plus the aloe vera extract in there, so that has a lot of healing and hydrating properties to it, which can be very good. And and then of course we've got the green tea extract in here too, so antioxidant support, which is always important, and it does leave behind a little bit more of that mattified finish to the skin,
which many acne skins like. It does have natural SPF too, so there's 2 ingredients in here that support an SPF of about 15. And so that's another thing many times that can be a good option of getting, sometimes a different type of a sunscreen, as we'll talk about a couple other options here next. But just knowing that it has that SPF. So we do recommend that more in the daytime as a day AM use. The Moisture Olay you can use AM or PM. Depending on what's going on with the skin. But I think the key thing with this is healing, matte finish, moisturizing to the skin without being too overly moisturizing for an acne. So, all right, and then let's go into the 2 SPFs or sunscreens that we kind of more think of as an SPF in that way, because they have the zinc. And so we've got 2 formulas here. We've got the E-Zinc Protection Cream and then the Daytime Defense. So we'll kind of talk about those together.
Yeah, and and with the E-Zinc Protection, as you mentioned, they both have that zinc oxide component. With the E-Zinc Protection Cream, though, it does offer a little bit more of a hydrating moisturizer sunscreen. But it's great for acne-prone skin. So, you'll have a little bit more hydration associated with that versus the Daytime Defense. The E-Zinc is also going to have an SPF equivalent of 18. And then it does have the turmeric extract in there, too, which can provide some additional anti-inflammatory properties. Whereas the Daytime Defense is the one that, SPF 30, we think about this product, and this is for, when you're going to be spending extended amounts of time outdoors. You want to make sure that this product is on. This is the product you want them to use post-care, to help reduce any risk of post-inflammatory hyperpigmentation during that peeling process. And, like you said at the beginning of the presentation, too, this could be, if they were oily enough, it could be almost like a
kind of
hydrator,
sort of
sunscreen, you know,
right.
where it just
It'll
provides
kind of
them
cut that oil too. I feel
yeah,
like, you know.
yeah. But great formulas, and both of them, you know, just terrific with that zinc oxide in there.
So yeah, just main difference thinking the e-zinc has the moisturizing components, the daytime more just your SPF, and that way both healing on the skin, and then of course the difference in the SPF factor being 18 versus 30.
Yeah.
We find that more people that are acne love the e-zinc because it's easy to go on, it's a one step, and so that's probably your go-to. But going out to the beach or really going to be in the sun or things like that, the daytime defense is really great for them too and can have it. And then some people just prefer one over the other sometimes, or it depends on what they're looking for, you know, and either one of those will be good. Now let's talk about the mask that we have, and then one enzyme too here, and so we'll get into that, and we're going to start with the Dermapeel. The Dermapeel enzyme is something that can be used particularly with more compacted skin. It's a papaya enzyme, but it's gentle enough that they can use that a couple times a week and really help kind of loosen up that skin like we're talking about, increase that exfoliation to help the process. Now, you want to explain to them how to use it though?
Absolutely. So
it's a little tricky.
It is a little tricky, but it's a fun product, and once you get the hang of it, it's so easy to work with. But teach your clients, you know, to take a small amount of the product, and they're going to apply it to their face, you know, all areas of their face where they're going to be performing the exfoliation. Start with a gentle circular massage movement. You feel that product start to liquefy underneath your fingertips, and then it starts to ball up. At that point, it's balling up with the dead skin cells. We don't want to keep massaging it, you know, let it sit there. They can let it sit for another few minutes if they wanted, or they could even remove it at that point too.
Yeah,
but
so it can be quick for them.
Yeah.
As a nice little quick exfoliation, you know, which could be really good. And then they could go into one of these masks, or if they're just using that, you know, so either way. But yeah, you want to make sure that they're using that circular motion and all of that and working with it on dry skin. When we get into the other masks, now the milk mask, you know, here for acne skin, and you might kind of be like, well, why? That's really a more supporting the other two masks, more so than you would just recommend milk mask. You know, it could on a really inflamed, acne's kind of gone, you want to, but most likely you're going to have this. In addition, you can couple it with the wasabi mask or the Perfection Clay to cut those masks and be able to have them use it and get the properties of each of these things more often without creating too much. Like, for instance, the Perfection Clay can create too much drying, and we'll talk about that in a second, or, you know, exfoliation or irritation. But the milk mask, you know, gives the softening, that's the best way to say it, but then it has so many nutrients, and talked about milk protein can be very healing for acne skin. It just depends on the acne and the person and all of that, but this particular formulation just has a lot of nutrients in it. So
a lot of healing properties, anti-inflammatory.
Just going to really help with all of that, you know, on the skin. So then, if you think about that, then you really kind of have more wasabi and Perfection Clay, and then you just bring that milk mask in there. So let's talk about wasabi and the benefits of it.
So the wasabi mask, you know, that wasabi extract, this is going to be wonderful for helping to reduce bacteria on the skin, reduce inflammation. It helps to stimulate circulation in the skin. We've got the green tea in this formulation too, which, as we've talked about throughout, you know, wonderful anti-inflammatory properties, antioxidant benefits, and it even has antiseptic properties as well. You know, but when you apply this one, if you were to apply it straight, it is kind of like biting into a wasabi piece. So it gives them that initial kind of rush of that wasabi extract, and then it subsides, which is why, like you said, mixing a little bit of milk mask could be just that right
good,
combination.
especially like for teens, because this one's really good for teens to use and do that, you know, weekly on their skin. But that milk mask just gives it, you know, a little bit nicer, especially if they're not major acne and they're using it. You know, they're going to maybe be a little sensitive to the wasabi, or it's going to kind of push them away from using it. So that is something to know. But yeah, I think it's just very vital. It really makes a difference to add in a weekly mask for these with everything else they're doing. They'll really get results. And so then going into the Perfection Clay, this is a bit different, okay? So this is your sulfur option. And we know sulfur tends to be really hot.
Yes.
And you know, gives you a different kind of
Well,
component.
and with this one, you know, it's designed to help with drawing out impurities in the skin. You know, it has the kaolin and the bentonite in there as well. It has the sulfur, which provides a lot of antibacterial properties to the skin. But it's really like excellent for the cystic acne.
Oh yeah.
You know, even spot treating with the Perfection Clay,
which is what we recommend more, I think.
than applying it all
Yeah.
over. But yeah, even spot treating it, it's just going to help to draw those impurities out, and you know, and that makes it easier for you when it comes time for the treatment room.
And again, on this one, when they spot treat, kind of same rule like with the fruit acid botanical or some of those that we talked about, is just do it once on that cystic acne or a lesion, and then don't do it for a couple more days, okay? Let the skin go through its little process, because if you do it 2 days in a row or morning and PM, you're going to get scabs, and that's not going to be what they want, or you know, it's going to create other problems. But yeah, spot treating is ideal.
And also, you know, making sure that you stress to your clients not to, you know, just spot treat and like leave it on and go, you know, watch a movie or something like that, because it's going to cause that dryness, flaking, peeling, you know, and it could be a little too aggressive.
We usually say keep it on for about between 5 and 10 minutes. And so kind of, you know, you might say 5 in the beginning, because usually they go over than what you say normally. So something like that. But those two masks can be really great. And I think what you were saying, Aubrey, on the cystic acne, that Perfection Clay is really, you know, can be helpful, and then just any spot treating and really make a difference. All right, so those are the products. Let's go into kind of quickly, we'll just briefly run through these as far as an idea of a starter regimen. So the first one is cystic, since we were talking about that, and we do have Perfection Clay on here, so that's always good.
Yeah.
So cystic acne for the AM, what are we thinking here?
Well, you know, we're thinking beta green tea cleanser, again, you know, antibacterial, anti-inflammatory properties, incorporating that mandelic arginine serum where, you know, we're going to get more antibacterial support, and then gently supporting some of that cellular turnover.
Right.
And then you have some options then for what kind of, you know, hydrator, if you will. Going the route of growth factor gel, which is going to promote a lot more wound healing in the skin, or, you know, if you're going like SPF and moisturizer, e-zinc, or just daytime defense too.
Yeah, so fairly, you know, simple there. And then we're really using our weekly, which is that Perfection Clay, to really help us with the cystic and really be able to kind of draw that out. We're also using the mandelic in this situation to help to loosen up, kind of like an AHA in this case, but not going too aggressive. Mandelic will help that. So as you use the Perfection Clay and the mandelic together throughout the regimen, you're really going to get to where that cystic can either start to come to the surface or then start to dissolve a little bit more. And then for PM, we do bring in here either the BPO, which we found to work really well, so that's your blemish complex, or then the vitamin A component. And you could go with salicylic serum too. It just depends on when we're saying Perfection Clay. Be careful of how aggressive you're going, because if you get over aggressive on the skin, you're going to exasperate and really sometimes create more acne or other problems with the skin. So that's what you have to try to balance. And so Synergy A could maybe be a better choice here, but it really depends on the skin, because even though we say cystic acne, oh my gosh, that could be a sensitive skin, that could be a really thick skin, that could be an oily skin. There's a lot of variables there. So this gives you a really good starter regimen to kind of go off of, but then you'll start to learn the different skins within it and be able to add more. And then if you did the growth factor gel in the PM, you could bring that over in the AM to just have one kind of moisturizer, wound healing support in the beginning, and then add from there so that you keep it pretty simple. Okay. So on the blemish complex or the Synergy A that you see on here, you want to pick one. We probably should have put an or, but anyway, you're picking one. You're not using both in the beginning. Okay. All right, and then we've got oily, congested acne. This one, you've got a little bit more choices here.
Well, you know, and when it comes to the cleanser choice, you know, it depends.
Yeah,
I mean,
it really
if there's an excessive amount of oil, or if they have a real thickening to that skin, then you want to go that route of the rosemary herbal because of that AHA component. Or like you've said too, if they come to you and they're like, yeah, I've been using salicylic acid and I'm not seeing any change, oh, well then switching to that AHA could be the key. Whereas, flip side of that, maybe, they're oily, but they don't have that thickening, or maybe they've got a lot of inflammation, then, beta green tea could be a little bit more anti-inflammatory as far as that goes.
A little more supportive. Yeah, so I think you kind of have to figure out, and could some be oily but yet dehydrated? That's where beta green tea might be a little bit better support, and then the rosemary. So either one of those, kind of figuring that out. The beta green tea lotion would probably be the best toner here for this, and really going to help to cut the oil and be a good support. And then the blemish serum during the day.
Yeah, getting that antibacterial, and as well as those wound healing properties too from the totara in there.
And aloe mat could be another one too that's not, any of those things we talked about could be here. It's like, well, what do you put? But hyaluronic can be really good. I've seen that work really well on an oilier skin, and it just goes right into the skin. You put it on and it really, and I don't know if I'd say it mattifies an oily skin, but it does really cut that oil and kind of gives you more of a dry, slicker surface, but not slicker, that's probably not the right word.
Well, the thing is too, it gives them a smoother
just a
texture,
smoother, but not overly dewy or anything like that.
No.
It kind of starts that process.
Yeah, which is like why you said, like an oily client, they're gonna like that because they don't want to have to deal with something that's gonna make them believe that they look shiny or greasy or that feels heavy, you know. So keep that in mind and let them touch and feel some different things too.
Totally.
Testers.
Yeah, that'd be good. So, you can go through that, and then for your PM, we're recommending the salicylic serum or the Skin Refine. So going a little more aggressive in the PM for this oilier skin, and maybe just using that, in the beginning, those every other to every third night, and then moving forward, Again, you can use the same moisturizer AM and PM in the beginning. So if you did growth factor gel or hyaluronic serum, then kind of keep them on that, and then add from there. We want to say too, with most of these, and didn't put them in here, but then the Lumicolor matte or the powder, and that adds another element of SPF as well. So you can bring that into the regimen, and that's important for that skin, because you're doing all of these steps and then they go and put on makeup that's not good for the skin, and so that's gonna not be good. And that, and you try to talk to them, and and sometimes you can get them to, they pull off the makeup because they realize, but here they can use something that will cover their skin, that will help them to feel good. And we've got the matte, which is a cream, and then it's a mattifying, or the loose powder, and you can use both together. So that would be really a part of every regimen here, and add an additional support, to the skin. This one's more of a dry acne, and this particular skin, I would say, is probably where this regimen is pretty good.
Yeah.
Like if they're really dry acne, and you can go with this and you're going to get good results. And you can, it looks like a lot on here, but when you take like the Hydra Complex or the grapeseed, you bring that down AM and PM and use the exact same one.
Yeah, so we're talking about, you could even be using the Beta Green Tea Cleanser, both AM and PM, so that's product one.
Yeah.
Hydra Complex and grapeseed, AM and PM, that's product two. And then, your Mandelic for the morning, that's going to be that AHA type of from the Mandelic acid, it's going to act like that AHA, increasing that cellular turnover, providing antibacterial properties, and then that blemish serum and the Synergy. I mean, that's just a powerful little duo that isn't going to cause dryness, flaking, and irritation.
And that blemish serum is really just that spot treater. So it's not like, with dry, you're just using it when they start to get another breakout, and it just adds, gives you a little bit more support on that bacteria. Now, some can have the Mandelic, and it can be enough when they break out, but it just depends. But having the blemish serum can be really nice. And then you could do a weekly here, a weekly too. Even though they're dry acne, they have inflammation, and they've got other things that are going on. So to kind of bring some healing and the green tea support within the wasabi, anti-inflammatory, all of that. That could be a good little combination and really support the skin. So the weekly's either or on this, but the AM PM regimen actually is really simple in a sense. It's just choices on there. Okay, so we just went through 3 just to give you a little guideline. Hopefully what we talked about so far and with the products, it helps you to kind of think, oh, I've got this acne here, and I could do that, and certainly reach out to us and all of that, and we can further help you with specific regimens and things, because there's so many different acne skins out there. We could do regimens galore. So let's talk about, before we wrap up here, just some things to kind of keep in mind when you are dealing with acne. And these are simple tips, probably a lot that you've already heard of. Certainly water intake and just health and nutrition, if you can really go there to talk about diet and things like that. That's going to be helpful for an acne skin. And so if you can, like I said, if you can get there, but certainly the water you always can, is just talk about increasing that, and that's going to help. This is what I wanted to talk about, that touching and picking.
Exactly. I mean, so many times they want to touch.
Touching.
They want to sit there and try to extract their own, acne lesions. And that's just not going to be beneficial for them at all. And so you have to teach them to avoid touching their face and spreading bacteria around. It's just going to make it into more of a breeding ground. And then from touching, scratching, or, performing their own extractions, that's going to lead to that acne scarring.
Yeah, and it would almost be good to have a picture of someone with acne and then their scarring. Because to show that, because after the acne's gone, you've got the scarring. And so sometimes to show that can help them to really understand that we're trying to prevent this. So we're going to be dealing with some of this acne here. We're going to get it under control, but we're preventing this. And here's some of those key things that you could do that actually cause this and create it to potentially worsen. And so I would, really talk to them about that, because that's huge. And like I said, we were saying earlier, if you look up scar in the dictionary, it says permanent mark. It's not something that you can really get rid of. And so that is really something to kind of hone in on, particularly teens here, we're talking, and things like that. The skin, cleansing it twice a day, but remember not to overstrip the skin. So that's where you want to bring that balance in and just make sure that you're really working within the regimen there. Using products that are non-comedogenic. Comedogenic. Getting the E's and the O's mixed up.
Right. But it's true though. So here you have them on this wonderful Rhonda Allison lineup, and then they're putting on who knows what kind of makeup.
Yeah, that falls there again.
So we really want to make sure that that they understand why.
Yeah.
And here's an option with RA Illuma Color.
Exactly. Right. Pillowcases, that's important.
Yeah.
I think talking about that, that's probably one of the, you can talk about so much, because toothpaste too, other things, but pillowcases are important.
Oh yeah, I mean, your hair has so much bacteria and just like oils and things like that.
Let me get it off my face.
And so it's one of those things where, if they change their pillowcase on a daily basis, they're helping to, again, just reduce some of those, increased bacterial breeding grounds,
And what you can do too, and I've seen some, is, they have those like soft kind of cloths. They're almost like washcloths, but they're like diaperish material. And I've had some that said that they just put that over their pillowcase, and then they can just easily remove that. You don't have to change your pillowcase every day, and it can still look nice on your bed or whatever you do. And then you wash a load of those, once a week. And so that can be a really good option for your acne, because it's important for all of us to be changing our, pillowcases and sheets and everything, but more so for acne, because the skin and the bacteria that can it's open, and it's almost like so vulnerable to bacteria and other things like that. And then the cleansing, we talked about that already, and then SPF, we've done that. So just some simple tips here, but just things to kind of keep in mind and talk about. And I think that's it. So thank you so much for joining us. And if you have any questions, of course, reach out. We'll see you next time.